Hey everyone, welcome back to TSC Connect. Today we have a conversation with Jerome De Leon, who is a physiotherapist in the Philippines. He is dually trained in both the Barcelona Scoliosis Physical Therapy School approach and the ISST approach. He is so passionate about his community, and in an effort to give back, he launched ScolioHub, which offers scoliosis-specific physiotherapy services in Cavite and Quezon City. Furthermore, Jerome is a one-person operation, which makes that even more incredible. In our conversation today, we chat about a lot of the barriers and challenges that his clients face, particularly in a medical system where many of the services that these clients need are private pay. And layered on top of that, how many of his clients don't necessarily have the resources or finances to be able to access these services at all. I learned a lot from this conversation and I really enjoyed it, and I hope you do too. Jerome, welcome so much to TSC Connect. I'm so pleased to have you on our channel for this conversation.
Thank you for having me. I'm so happy and honored to be here as well.
Yeah, awesome. So maybe let's start with tell us your story. So tell us a little bit more about where you are in the world, a bit about what your background is, what drew you to physio, and especially to the scoliosis world.
Right. So hello, everyone. I'm Jerome, and I am a practicing scoliosis or Schroth Physiotherapist here in the Philippines. I grew up in the province of Cavite, and it's about 45 minutes away from Manila. I am the first in the family on both my mother and father's side to take physiotherapy as a course, so I don't have someone to guide me through this path initially. I enrolled to physio in uni with zero idea on its background, aside from it being a good pre-medical course. So my path to scoliosis, it's quite interesting for me because I think it came in naturally. I didn't force myself to become passionate on this field. And looking back, I realized that there are small instances where I discovered scoliosis, or basically led me to discovering scoliosis rehab or Schroth. First is during my student internship back in 2016, we were assigned a case of a 17-year-old girl with mild scoliosis, and to know what is the most appropriate therapeutic exercise based on the latest evidence in a third world country or in a low resource based setting. So we found that the most fitting exercise program would be like task oriented exercises with active self correction. So it's basically like scoliosis specific exercise, but I didn't know that back then. And then surprisingly, there are no claps exercises, which is mostly recommended or done here. And then the next one would be Schroth. And we can't do that because it requires formal training and so on. So I didn't get into details of Schroth that time, and I just know it like it exists by name. Now, fast forward to 3 years after, and then I'm working at my first formal job in a hospital. I encountered another patient, a 14-year-old girl with scoliosis and a candidate for surgery already. And so talking to them, I feel the anxiety of the parents because learning about surgery can be quite daunting for teens. And then if they're a candidate for surgery, then it's going to be very, very scary for the whole family as well. And at that moment, despite being forgetful at times, I remembered about the task-oriented approach and Schroth. And I felt like, oh, I can for sure help you support your child or this patient, but like it dawned on me, oh, I don't have the formal training. So it's very frustrating to be in a position where you can do something, but then somehow you can't. And so that's when I started, to train for Schroth.
So at the time, so it sounds like you had some of this exposure. So then when you learned about Schroth, did you Google, what were the available training courses? Like, did you look into what the options were?
And so I found out about ISST and BSPTS, about these two are having, really good published studies so far. and I checked out how much it costs and where I can get it, and then I just got surprised because like I'm earning 300 Canadian dollars a month as a physio in that hospital, and there's no way I can afford to travel that and go abroad. And so it's thanks to my parents. It's parents to the rescue always. And then they were kind enough to lend me some budget, and to afford training and travel abroad.
Yeah, so you touched on two really good points there that I want to dig into a little bit more. So number one, the very real challenge that a lot of therapists or professionals or any people really in developing countries have, just by nature of the financial the exchange, the currency exchange, that you're at such a disadvantage. It's so difficult to even access this information, right? So like I would like our audience to be aware that exists, and that presents so much of a challenge to provide these services to these people in developing countries. It's hard. It's such a barrier for the therapists, right? Just to access the information. And then the second thing that I thought you found really interesting there, because my family is also Filipino. I was born and raised in Canada, but my parents immigrated. So I'm still, I was very much raised in the Filipino culture. That idea of family support. And, I think that's quite common in the Filipino culture when the parents are able, that they're willing to support their kids. We'll get into this a little bit more later, but do you see that trend also applying to some of your, say, teenage clients? Like, how would you describe a typical, family dynamics of a Filipino family in the Philippines?
Mm-hmm. Right. So I think for teenagers, they are very dependent to the decisions of their parents. We know that sometimes teenagers wanted to be like more independent, but when it comes to health related concerns, they just wanted their parents, to answer all the questions that they have for them. If ever they're having pain, they're just gonna look at their parents and that, do I have pain? And so it's going to be really it's like treating a family altogether. You're not just treating a patient.
Yeah, I think that trend is also very similar here and I'm going to go as far as to say that's common around the world, that because scoliosis affects this teenage population, we can't ignore the parents, we cannot ignore the dynamics of the family, and the culture of that that family, of where they are in the world. Here in the Western world, there's a lot of value placed on autonomy and independence and empowerment, but perhaps that might not be the same in a lot of other countries, right? So it's good to know that there are these differences that are really important to consider, not just what is the best exercise, how many minutes should they do it for. We have to really zoom out as healthcare professionals and look at all of these other factors. Mm-hmm. So tell us, what led you to open your own practice?
So the main goal in mind was to give back to the Filipino scoliosis community. First, because I realized that most of my trainings were not self-funded. I mean, technically not self-funded, because I have my parents to help me. I have my friends or colleagues to support me all throughout. And I feel like, in a way, to be more grateful for them, I have to give back to those who need this method. I set up this small clinic because I don't want, and I named it ScolioHub because I don't want to name it after my name, because usually it's like Jerome De Leon or physical therapist, and it sounds so narcissistic or something. I just want to create a brand, that would help teens enjoy. And I don't have any plans of making this like a really big enterprise or something like that. It's just a way for me to give back. And I started this small clinic a month before lockdown, so you can the stress surrounding it. And what's so nice about it is that this is just an extension of our house. So I think my parents are very supportive of me because they found the value of these exercises and how it can help patients. And so they helped me, set up this small clinic. And so when the lockdown happened, I don't have to pay for any rent, and we didn't have to close, like really close, and like omit the business and stuff. But I had to reinvent ScolioHub into an online platform, and you know how difficult it is,
Yeah.
trying to figure out your role
Yeah,
in physio.
especially, we went through the same thing, and I know a lot of other therapists did too. Like, how do we take our service, which especially with Schroth, is so hands-on and so specific and relies so much on the feedback from the therapist to help the client learn how to move their body. The big question when COVID hit was, how do we possibly take that online? How can we remove the manual and rely more so on our communication and our educational skills and our instructing? So I think it really challenged a lot of people to like become more clear in their speaking and become more intentional with what they're saying and what they're teaching. So I can imagine that must have been so hard, especially because you currently are a solo practitioner, right? Like, do you have other therapists?
No, I really just work alone.
Yeah. So on that note, give us an idea of the landscape of scoliosis in the Philippines. So for example, how well known is it? Is there a screening process, or what happens when somebody, teenager or adult, is diagnosed? What are, like, where do they go? What are the treatment options that are available? And how many other people do what you do?
So there are no formal screening programs in the Philippines, and some colleges or universities create their own program for their interns, just to experience scoliosis screening. But based on the short time that I'm working here in scoliosis rehab, I noticed that in cases where it's typically late seen, it's usually discovered by the patient through their annual physical checkup in their company. So employees tend to have like an annual physical checkup, and then when they do their chest x-rays, they found out that, oh, I have an impression of a curved spine. And then they will be referred to an orthopedist to check if this is something, and then if that's if it's also referred to physio, it must be referred to rehab doctor first before coming into us. And so I think that point really highlights how this condition is often neglected as kids, and now when you're working maybe at 24, 25 years old, where their bones are fully mature, they just found out that they have scoliosis. And then the next one would be it's usually the parents that check the child's posture. And so when they see some changes in the spine, in the posture, they usually check Facebook first. What does this mean? And then they go to their doctors, or often they ask threads on Facebook, comments and stuff like that. And so Facebook is a really powerful tool of information here in the Philippines. And I think Filipinos are one of the greatest consumers of social media and Facebook. So so before going to the doctor, somewhat they have information in mind, and you just have to confirm or review their information about scoliosis, because most of them are quite questionable.
Yeah,
So,
no, you make a good point that the easier than ever, and often regardless of income level for the most part, unless I would say they don't have access to the internet. But even in that case, would they be accessing Facebook on their phones? Yeah, and so exactly. So Facebook is readily available to so many people in the world, and it's true that anyone can post information up there. And so, like, what are, of course, we can see how that would be challenging. But do you find that there's a difference in how much people rely on social media depending on their income level and educational level?
So I think it's more of Facebook does not discriminate whether it's from a high earning family or lower earning family. It's just that higher earning families have more access to healthcare services that they can confirm if these claims on Facebook are true. But for the lower income, lower earning families, when they see something on Facebook, they would probably say, "Oh, you have to do this at home because I've seen this on Facebook or YouTube, and this is free." So they try different methods on how to do that before going to the doctor, and maybe by the time that they go visit the doctor, the curve has worsened, and then they would probably say, "But I'm doing the exercise at home, and like these are the available exercises," and then they send links to YouTube, and unfortunately, some of these aren't really scoliosis specific for them, but it takes a lot of understanding to where they're coming from, because it's very hard to impose that, "Oh, you should have visited the doctor when it was just like very mild or something like that." But the logistics behind a lower earning family visiting the doctor is more, it is costlier than expected. For example, they have to make sure that they have proper social services to go to a doctor. Taking a scoliosis series X-ray is quite expensive as well compared to the other X-rays.
So,
And
so
then,
X-rays are private pay in the Philippines?
generally, it's private pay.
Hmm.
And scoliosis series or scoliogram, I think it's rather more expensive really than the typical chest X-ray, because and not all clinics offer scoliogram or full spine X-ray. So that's another limitation or challenge for the family.
And I would imagine that depending on where they live, you know, there's the transport costs, and depending on if both parents are working, that would require somebody to take a day off of work, and therefore opportunity cost. There's a loss there. And then in order to take their child to the physician or to get an X-ray, right? So there's so many layers there of how a lower earning family, you know, what other challenges they might face as compared to, you know, a higher earning family that might have more resources and support. And so then if they don't have access to physiotherapy, if they don't have access to bracing, are spinal fusion surgeries popular? Are they private pay? You know, what's the wait list? What's the system like if somebody needs a surgery in the Philippines?
So most of the time, we hear or we see posts online on scoliosis support groups about children being a candidate for surgery already. And more or less, if it's a government-funded hospital, they would have to pay for like 500,000 pesos for the surgery. And so
the family would have to pay that?
And that's already for the government-owned hospitals. Either that or
sorry to interrupt you, to give people an idea. 500,000 Philippine pesos is equal to 12,500 Canadian dollars or 10,000 US dollars. And again, you mentioned, do you have an idea of what the minimum wage or an average income is a month?
So right now it's about 537 pesos a day for the minimum wage.
Okay, so that is 13 Canadian dollars a day for minimum wage. Okay, yes. So $12,000 that the family would have to pay privately is no small fee.
Yes.
Okay, and so are there any financial supports for families?
So some families go into government offices with their letters of support and asking for sponsorships of different politicians. And then there are NGOs, surprisingly based abroad, who helps Filipinos, get scoliosis or spinal fusion surgeries available for us. But they can definitely support maybe like one or two clients a year. I'm not sure like the whole system, but it's the bottom line is they're based abroad and they're offering charity services here in the Philippines. So that's quite challenging in our case right now, is that I feel like scoliosis is indeed a very expensive condition, and only those who have enough support or financial support can for sure attain the proper treatment. And I think that's quite sad, because I hope like there's more, support for training of physios of our both private and public hospitals, just to support these kids, because the cost and expenses in the future will be greater, than to invest the prevention part of this aspect or condition.
Absolutely. And that's a trend that I think is common also in the Western world. Although scoliosis doesn't only select affluent people, so it affects all populations. However, it is often the people who have the resources who can access services like ours, like even at the ScoliClinic, because of the way that the medical system works here in Canada. Physiotherapy is similar to the Philippines. It's a private service. Canada, contrary to popular belief, we do not have universal healthcare. There are certain things like emergency healthcare and surgeries and things like that that are covered by our government. However, things like this are not. And so what we end up seeing, that we're very aware of, is that the population that we see in the clinic is not representative of the population that is outside our doors. We're aware of that. And this is something that we're trying to fix in the long term, right? How do we create service for people who struggle to come to private clinics? So you've shared your experience and a lot of the challenges that these families of teens and adults who have scoliosis and what they face, particularly in the Philippines. So in an ideal world, what sorts of solutions would you like to see?
So first is, I would say it's more of the imaging part, because we need X-rays or imaging to diagnose scoliosis, definitely. But maybe someday in the future, if there's some real-time, accessible, and accurate imaging of the spinal curves with very low dose of X-ray, or maybe not even X-ray, I think it would be really good, because you don't have to wait for another 6 months to check their X-rays, or even when you do your physiotherapy sessions, like you can see the changes in the spines, and that would initially motivate the parents and families. So, oh, you're doing a great job in these exercises.
Yeah, so something
yeah.
like, for example, like an ultrasound machine, or maybe a topographic machine that can measure the contours of the body, perhaps. Yeah, and for people who are watching, those two options are available. They're still being validated to the full extent, but also that machinery is quite expensive to acquire, especially as private practices in the first place. But that's a really good point. Other options for imaging. Great. Yep. What else?
The next one would be accessibility to proper braces and treatment. This should be covered by the national insurance. And I guess last would be accessibility and education of training, especially for physiotherapists and doctors as well, because we understand that we can't work alone in treating scoliosis. We have to work in a team, and the best results always come from an interdisciplinary approach. And for example, we try to promote scoliosis-specific exercises here back home, and then when it comes to the doctors, they would ask, oh, so how many physiotherapists offer scoliosis-specific exercises, or how many of them offer or are trained for Schroth? Oh, but I'm the only one, and like I can't, of course, manage to treat everyone. That's impossible. And so what we wanted to do is, hopefully, maybe not specifically Schroth method, more students or people, or physios rather, are trained to handle scoliosis patients, or even get to know what the guidelines are about scoliosis rehabilitation. We're in a very tough position right now, but we're trying to slowly provide some solutions for that.
Yeah, and the same is here in Canada. Scoliosis is not taught in the average physiotherapy curriculum, and so even many of our colleagues aren't even aware that this special training exists. And I agree with you, slowly it's becoming more well known, but we're still very far from where we need to be based on the prevalence per population. Both Canada, we have a much, in Canada, I think we're 40 million or something. We're much smaller population than the Philippines, and we're much more spread out geographically. But even for that amount, there just aren't enough physiotherapists in those different areas, geographical areas, who have this training. So, there is a growing community of, international scoliosis healthcare providers. So do you have any ideas on how members of this international community can work together? How can we, support you and support other therapists who are in your position in other developing countries? Like what sorts of supports would you like to see?
No, I think it's more focused for the patients. If we are going to share our information about scoliosis, I think we have to adapt to technology. Right now, TikTok's like the craze, and bite-sized information within like sharing their experiences within like a minute would be like the best way to reach out to them. Imagine Gen Zs are all in TikTok and then they see like different, experiences of people with scoliosis being empowered, and then that's going to give a strong message that, in this age, like we have these available treatment options and how they affect us in terms of managing their curves. So it's more of trying to connect or fill the gap with the available research that we have, and like reaching out to our lay population on the proper communication skill set that we should have. Because I can imagine like writing a long research paper is so much different to communicating that exact idea to in a TikTok platform or a Facebook platform. So we have to, I mean, as physios, we really have to learn how to use TikTok.
Yeah, and I'll admit that it's something that I've been avoiding because it just feels like so much work, and we have other things, and I feel like, oh, I don't know how this works, which it probably ages me a little bit. But I think you're totally right that there's so much value in the skill set of being able to gather the complex information, package it, and disseminate it in an understandable, simple, and, like you said, digestible way in the methods that people are actually consuming information. So I think that's probably a really nice message to the therapists out there that I agree. I think many of my colleagues here in Canada too, we're all avoiding TikTok, but I think it can be harnessed in such a way, and it has to be harnessed in a way if we want to disseminate. We can't prevent misinformation, but we can at least add to the noise and be like, hey, but this might be some other perspective that you can consider. So, we can't prevent other people from posting, but at least we can, if we don't put our voices on there, then the only information they're going to get is what other people are putting out. So I do feel, thank you for that encouragement to just like, to take that initiative and actually do it. Is there anything else that you'd like the world to know?
I think it would boil down to we are more similar than we're different, I guess. In terms of experience, we're all humans. We experience the same thing, and it's just that I guess we just need to be with the proper people to support us. Not even like in scoliosis cases, we just need to have a really good support system. And we have to say like no man is an island, and so we just have to work together. And I think that's the only way on how we can address this concern. We just have to really empower each other. As therapists, we have to empower each other to teach or how to perform like scoliosis specific exercises. Physiotherapists empowering patients empowering each other. I think that's the whole idea of having this like ideal world where everyone's just supported very well. And hopefully we're still alive when when that happens.
Well, like I think, let's work together to at least move in that direction. And I think that's definitely something that's doable in, our career and our lifetime. So, Jerome, I so admire your dedication to your work, your generosity with your patients. It's very clear how caring you are and how much you really want the best for them. And I really thank you for sharing so many just gems in there, and also to shed some light on what therapists and families face, particularly in developing countries, and the similarities and how different it can be, and what the other layers of challenges are. So I just thank you so much for your time. This was such a pleasure.
Thank you very much as well. I enjoyed our time chatting.